Hi everyone, Lindsay, Engel, and John Leman here again with Elite Insurance Partners and MedicareFAQ.com. Thank you again for taking your time today to join us on the last day of National Medicare Education Week. And today we're going to be debunking some Medicare myths for you. So, John, fact or myth? Medicare and Medicaid are the same thing.
That is complete myth.
Myth busted. So, what are the facts?
Well, the facts are that Medicare is a federal insurance program for those of 65 years of age or older, under 65 with disabilities, or people with end-stage renal disease. And Medicaid is a jointly funded insurance program for individuals and families with low income.
Okay, thank you so much for clarifying that. So, John, another common misconception is that Original Medicare covers 100% of your inpatient and outpatient services. Fact or myth?
Myth again. So what happens here is Medicare Part A has a deductible of $1,364 per occurrence or benefit period. So individuals are subject to paying that deductible each time they go into the hospital for a new occurrence or a new benefit period. Now Part B covers only 80% of your outpatient services, leaving beneficiaries remaining with 20% to cover themselves, which now comes into play a Medicare supplement known as Medigap, which could help cover the Part A deductibles and Part B 20% co-insurance cost.
Awesome. Thank you so much for clarifying that.
Welcome.
So lastly, one thing I hear all the time is that once I'm eligible for Medicare Parts A and Part B, that I can sign up anytime. Myth or fact?
3 for 3, Lindsay. That's also a myth. The reason being is because you have two specific enrollment periods in which you can sign up for. One being the initial election period, where you have 3 months prior to your 65th birthday, the month of your 65th birthday, and then 3 months following your 65th birthday to sign up. And then the other option is during the general enrollment period. So if you miss enrollment in the Medicare Part A or B during your initial enrollment period, you would have to wait until January 1st through March 31st to sign up for your A or B, and that takes effect on July 1st.
Okay, that makes sense. Thank you so much for joining us for National Medicare Education Week. I know John and I really enjoyed making these videos for you. Stay tuned for additional educational videos, and in the meantime, if you have any questions, feel free to post them in the discussion below. Until next time.